do it that way, but right now it's just going to kind of be off the cuff. And mind you, this was 4 years ago. So, but this was actually February 8th of 2016 was when I was diagnosed. And I want to say that my first surgery was like the 15th of March. So I met with my gynecological oncologist, Dr. Kelly Schneider, at Novant Gynecological Oncology. She's great. She is a cancer survivor herself. And they just, the plan was to, that just is all sort of a blur, honestly. So now I'm thinking about it, I'm just like, what did she say? The fact that I had my first surgery ever. I've never been really sick before this, or before that happened. So it's like, and then anyway, so my first surgery, my first time with anesthesia, any of that stuff, my first surgery was laparoscopic, and it was to move my ovaries, disconnect them and move them up out of the range of radiation. So apparently, I guess we must have had the discussion that it was an aggressive form of cancer, and the typical treatment for that would be chemo and radiation, 2 different types of radiation, and 6 weeks of chemotherapy. Cisplatin was the chemotherapy that I had, and it is all of this is standard, and it's all done by numbers. So it's basically the highest rate of survival is this treatment plan, the chemo plus 2 kinds of radiation. And that was meant to, to get rid of it. So, and one thing she did also mention is that and I will never forget, because she called it a big dumb uterus. Don't know what that was about, but either way, my uterus was supposed to block the radiation, kind of serve as an absorber, I think, of the radiation. And I'm thinking that didn't happen. But either way, so I had the surgery to move my ovaries up out of the way of radiation. That was the first thing that happened. And I started chemo like 2 weeks after that. And the radiation 5 days a week. So I drove myself to radiation. I did radiation, the broad radiation, getting the scanner. I did that at Gaston Memorial, I think is what it's called. And they have a great oncology place over there. So I went 5 days a week, 10 o'clock in the morning. I drove myself every day for 4 weeks. And it just so quick. Like, it just happened so quickly. You go in, you give your name, they call you back, you do your scan, but it starts with, so I guess, see, this is why you talk about this so later, but they actually tattoo you first. So they do 3 dots. To kind of gauge where they do that broad radiation, and where they line you up on the machine. So they did my 3 little tattoo dots, but so that was my first appointment with them. But then either way, so I had 4 weeks of this broad radiation, and I had chemo once a week, and that was, I kind of don't want this to be the longest video ever, but that was just definitely I don't know how to explain it. It was it's just not I don't think what you kind of expect or something. But either way, you go into this room and you check yourself in, you get your wristband, and then they open the doors and you go into this room with recliners, but they're not even that comfortable, those plastic hospital chair recliners, and that's for the patient. And then they have these hard plastic chairs for if somebody comes with you. And I mean, it's this big room with all these people in it. I mean, we're all just sitting next to each other, across from each other. There's 2 TVs, and it's all very and you're getting pumped full of poison. It's just all very, it's just weird. So, I remember my first chemo, I could not sleep. Obviously, I was super, nervous and whatever the night before. And, I think I had taken probably an Ativan or 5. And I just remember when I got there, because they give you Benadryl first. So, they give you pre-stuff. So the day before you have to go for pre-chemo blood work. And then the next day you do their chemo just to make sure your numbers are good enough to do chemo. Another thing is I opted not to get a port. That was, for whatever reason, I made that decision. I did not want, in the beginning of all this, I didn't want anyone to know I was sick. I didn't want anyone to know. I put on makeup every day. I did my nails. I was going to be the least sick looking person that there was, I guess. I didn't want anyone to feel sorry for me, and I definitely didn't want like a garage door opener implanted into my chest that went into like one of my central like big veins. Like, I'm so freaked out by needles and blood and veins. Like, those three things. Like, I freaking hate them. And I just did not want a port. Like, it was just, I didn't want it. Either way, they were like, well, and I've never, I never been sick, so I didn't even think about so many times going into your veins and stuff. Either way, long story short, that first chemo, I was probably knocked out. But actually, something really kind that someone does is a volunteer gets the name, they started this on their own. But it's really actually amazing. But they know whose first chemo it is, and they put together a bag of like just stuff like candies, or I don't know, stuff that the coloring books, stuff that will kind of entertain you. It was actually really, really nice that organization does that. And when I'm more legit and official about this, I need to shout them out and figure out who they were. But they were great. But either way, that first one I don't really recall so much, just because I think I was so scared, and then I was just knocked out, because they give you Benadryl beforehand. I think it's just to stop any allergies that you may have, or something. But I think it was a Benadryl anyway. It just, I don't really know like what it was, but you start to just get this like a very uncomfortable feeling. So the next time I went to chemo, the next week, I was like, I do not want to be so out of it. Obviously, like I was actually really embarrassed, honestly, and then people were like, don't worry about it, because it's okay to be nervous or whatever. But I'm just like, it's not okay to be kind of like incoherent. So I was way too coherent the second time. Like, I just knew too much. Like, I was too aware. Like, that was actually the first part. Like, the hardest part is kind of gauging, like, where, like, how to, cope with that and, deal with it without over medicating or whatever, it is. And so, yeah, definitely that second time was just, you can feel it going into your vein. It's just not good. So I guess the one thing I will say is that my mom, after that point, really fought to get us into, so the last 3 chemos that I had, I was in a room, because I had such a bad reaction to it. I believe it was the 3rd time where I started vomiting before I even finished my 3rd chemo. I think that's when I started to really not tolerate it. And so I started to get pretty violently ill before I even left chemo. And so the next 3 chemos that I had, my mom sort of fought and argued with them, which was nice. But then I also felt bad, because I was like, why am I in one of like the more secluded rooms and no one else is, And you could make the argument that my mom fought for that for me. An advocate can does help you. So, but I still remember feeling slightly guilty about that, and just it not, like, why should I get this, even though it did make it such a better experience. Maybe this is where my guilt started too. I don't know, but yeah. So again, one thing I do want to say about chemo, you have to legalize marijuana. You cannot have these people. I mean, I was on, so you have on like, it's a whole regimen that you take. They have you on steroids, nausea medicine, like 3 different kinds of nausea medicine. I remember the steroids, because you don't take those until like the second, and like you have 3 days, like the 2 days after you finish chemo, you take the steroids. And those things are like, yeah, I guess if anybody else has been on steroids, you get it, but like that was a different thing. I was just kind of like, oh, I have so much energy, but like you don't really. I think it's just false. But and then like that 4th day, you feel like total shit. But with that said, I did really fairly well. I was so positive again. Like, I was super positive. I had such a great support system, and I really did do fairly well through chemo. I didn't my numbers didn't go down to a bad or to a sort of dangerously whatever low level until the last one. So that's I had to have a blood transfusion my last chemo, and my numbers stayed fairly well until like that last one. But I completed chemo, the 4 weeks of the broad radiation, and then there were 5 tandem radiation treatments, and these were, I can only describe as the first time I was tortured. So after that, after I finished the chemo and the broad radiation, that next week was so it was 2 scheduled in a week. So, and you had to get up at 4:30 in the morning, be at the hospital, I think at like 5 maybe, and you know, then they put you under anesthesia. Okay, they put you under, which that to me is traumatic in itself, because you don't remember. It's just scary to like go out and then wake up and something's happened you don't know. Anyway, you weren't aware or conscious anyway, but okay. So with that said, tandem radiation. So basically they put you under anesthesia, then they put this thing in you, and I guess I've never actually seen it, to be quite honest. I don't know if I want to, but it's gotta be like a beeper. I don't know, either way, it's not, I don't feel like contours to the inside of your vagina. Because it did not feel like it. It felt like something that was way not right, not the right shape, way too bad. It hurt so bad. The pain. Apparently, and I had a catheter in for the first time. They didn't even tell me that. I never had a catheter before. But apparently they didn't drain my bladder the first time, and they were really supposed to do that because it was just the most painful thing ever. And they sort of weren't really even like paying attention to that. Like I was just like, so seriously, this hurts so bad. I was screaming in pain. I mean, my mom can attest to it. It was just so, it was terrible. So then they roll you downstairs to the bottom floor, and then they lay you on this table, and then what they do is they connect like electrodes to it, I guess, or like wires to it, and then somebody goes behind a thing, presses a button, and then they come back, and then they wheel you back upstairs, they put you back out, they take out the the device, and then they wake you back up, and you're in recovery. So this happened 4 times, and it just was a miserable experience every single time. I mean, that much anesthesia, you know, just that, oh my gosh. And so about the 4th time, so yeah, by the 4th time, and I had a kind of a weird relationship with my radiologist at Novant in Presbyterian. I say weird, we were just in mesh. I didn't feel like he was hearing me about how uncomfortable everything was, and so anyway, so we didn't have the best relationship, but he ended the treatments early, 1 treatment early, because, and I quote, that he couldn't be sure he wasn't doing more harm than good. And my mom has said this before, and it's just something it's just, she says it and it kind of feels true, that this was the point when we sort of realized that maybe something was not right. And yeah, I think he sort of knew maybe something was not right. But I was thankful. Anyway, I was happy because I didn't have to do that anymore, and it was because it was miserable. So that was that. And then I had another scan to see, what the tumor looked like, and, the kind of what had happened. So it turns out that the chemo and radiation had only shrunk the tumor by 70%. So at this point, I needed to have a hysterectomy to have my uterus and the tumor removed. And my hysterectomy was on June 1st, 2016. Now, mind you, I was diagnosed in February 8th of 2016. Shortly thereafter, I had my first surgery, then began chemo and radiation almost immediately after that. Then I think I had a week. Actually, my aunt lent us her beach house, and sort of begrudgingly, my mom came along with me, it feels like. But either way, we went to the beach for a week. That was actually really nice. I probably really look back on that time as one of the happiest times I've had in a long time. But yeah, so then I needed to have the hysterectomy. So I went to the beach for a week, and I came back, and then I had the hysterectomy on June 1st. And so, in an effort not to make this the longest video ever, I guess that will wrap up my diagnosis and cancer treatment story, because I had the hysterectomy and it was done laparoscopically, and everything was, from what I understood, good to go. And they sent my uterus to a big teaching school, which it came back and did confirm that it was clear cell adenocarcinoma, the 1% of cervical cancers that are not due to HPV. And so I don't know what really that means. But yeah, so I had the hysterectomy, and then started the year of things going downhill.